Welcome to our x-ray room. One of the most common reasons to take x-rays, especially for the low back, is low back pain. It's actually an indication that if you have low back pain, x-rays are one of the most important tools that we can use to isolate and again, deep dive to try to figure out the problem. X-rays are really beneficial in showing a lot of different aspects of a condition. We can see everything from disc pressure, arthritic changes, so to speak, degenerative disc, degenerative joints along those lines. But then one of the most valuable tools is to evaluate the structure. We can see structural changes in the back that may be the root cause of a lot of back pain. We often get questions, do I really need x-rays? One of the great responses to that is if you want to have a comprehensive program to fix potentially the problem behind your back pain, then x-rays are really necessary. Some people will talk about, well, x-rays don't really show soft tissue. They do in an aspect. We can see a lot of things, especially with digital x-ray. We can see a lot of the soft tissue. However, it doesn't suffice for an MRI that can really truly show soft tissue like disc herniations, but we can find a lot of indicators that might point that to a direction of an MRI if necessary. But this is a first step. It's a very inexpensive, very effective tool. We also get some questions, are x-rays safe? Interesting enough, digital x-ray has come a long ways. This is a high frequency unit, and a digital x-ray high frequency unit reduces the radiation of exposure quite significantly compared to days past. We used to use a correlation that you actually get more, specifically about 7 times more radiation on a commercial airline flight for a couple hours than you do in a basic series of the low back. The other thing with x-ray, it's really important, is to make sure alignment is taken into consideration. So thus you'll hear sometimes people like, I have back pain when I stand or sit, but not when I lie down. This is why we take standing films. Standing films help us to evaluate a structural issue, not to mention that this entire room is laser lined, everything is completely level. So when we take these x-rays, we can actually do a phenomenal x-ray analysis and structural analysis to see if there's deviations from normal. And just like a normal blood pressure or a normal height or weight, desired height and weight and things like that, we can actually look at and compare the spine through an x-ray to a normal and see if it's abnormal. So really objectifying the process here without any guesswork, like it could be coming from this, it could be coming from that. I think one other key component of x-rays is that it also allows me as the doctor to actually make a call. Sometimes back pain is not something the chiropractic could help with, meaning it could be coming from something else. It could be coming from abdominal aneurysm, it could be coming from a mass in there. And so these are really, really crucial components that we can deep dive in here and figure out if you're a fit for chiropractic, a fit for the care that we do. And if you are, then it is one of the most comprehensive looks at your low back problem that could be causing your pain.